Dr. Sack, in the first segment we talked a lot about what is addiction, how you recognize it, but now that we've gotten to the point where you're recognizing what an addiction is, if you have one or if your friend has one, what's the next step? What do you do to treat that addiction?
Most people struggle with recognizing their addiction. And so what we say at Promises is that all treatment is consequence driven. It's not like someone wakes up in the morning and says, gosh, this is really a good day for me to get sober. Usually something happens to them. They get arrested, mother finds their stash, they drop out of school, and their parents find out that they flunked out, they crack up their car. So that a lot of times people aren't even thinking about getting treated when they're forced into treatment
It's the
as a
rock
result
bottom kind
that's
of
right.
idea.
Well, they hit a consequence.
Yeah.
And so the first step really in treatment is to have an honest conversation about, well, why would you want to give up your drugs? In other words, how do you feel your life would be better if you weren't using versus whether you were using? And that conversation is really part of a technique called motivational interviewing, where you're sort of saying that in order for someone to stop using, that motivation has to be coming from inside of them. And so the role of the therapist is to really draw that out of them. And so you have to be prepared to say, well, why would you stop? And usually the first reaction is, well, hell no, I'm not going to stop. I'm just here because I have to appease somebody. And so it takes a while to have a conversation where you really can say, well, you're here for a reason. Tell me why you think you're here. Like what got you here? And is that really a good thing or not? And when you start that process, people start to look at what's going on in a more objective way. So instead of trying to hammer someone over the head and saying, you're an addict, you have to admit you're an addict, and if you don't admit you're an addict, we can't treat you, you're really inviting them to have that conversation.
So it kind of draws it out of them themselves rather than kind of pushing it upon them.
That's right. It basically says different people have different motivations for why they would stop using. And so rather than try to apply a cookie cutter approach that says this is why you should stop, you're really asking them to evaluate how they got to where they are and what's really going on. And that process is called the contemplative phase, where you're trying to get people to at least contemplate treatment, and then you're going to move them to actually plan what they're going to do about their addiction and how they're going to get better, and then the rest follows.